Town Hall. We're giving everyone a few minutes to join and sign in. So please sign in and know that we'll get started shortly. Thank you. Hi, HAP is here to help today to answer any of your questions regarding COVID and Medicare. We are in the process of getting everyone logged in and signed in, so we will be starting our program here shortly. Thank you. Hi, thanks for tuning in to HAP's Medicare Town Hall. We're giving everyone a few minutes here to join, and we'll be ready to start our program here shortly. Thank you. Hi, if you're just logging in, HAP is here to help today with our Medicare Town Hall. We are just allowing folks to join in and sign in, and we'll get started here in just a moment. Thanks. Hi, if you're just joining, we're just allowing folks a minute or so to sign in and log in here, and we'll start our Medicare Town Hall in just a moment. Thanks. All right, we'll get started. Hello, everyone, and welcome to Health Alliance Plan's Medicare Town Hall. I'm Steve Solinsky. I'm the Vice President of Product Strategy, Marketing, and Community Outreach at HAP. And I'm excited today to be joined by Dr. Peter Watson, HAP's Vice President of Care Management, Quality and Quality Outcomes. Dr. Watson is also the Medical Director of HAP, and HAP's empowered our Medicare and Medicaid subsidiary. We're here today to answer your questions about COVID-19 and make sure you have what you need to know during these very challenging and unprecedented times. We have some questions that have been prepared based on the calls we've been getting in customer service, but please feel free to jump in and ask us a question at any time. We'll be answering them live as we go, and if for some reason we don't get to your question, we'll make sure we get back to you after this recording so that we can answer all of your questions. To answer or ask a question, simply submit your question to me in the comment section right below. All right, well, before I turn it over to Dr. Watson, I'm not sure if all of you are aware of this, but in addition to his duties at HAP, he has been also in the recent weeks spending a lot of time working with patients at the health system who are impacted by COVID-19. And I just personally wanted to give you a shout out, Dr. Watson, not only you, but all of your colleagues, all of our healthcare heroes, and just say a big thank you for all the hard work that you are doing during these challenging times.
Thanks very much, Steve. It's an honor to work alongside my colleagues in the hospital. Of course, I work full time with you from home, supporting Health Alliance Plan during the weeks, and have in the last few weeks been trying to do my part to help out my partners at Henry Ford Health System, Henry Ford Medical Group, as an inpatient hospitalist. And people are just doing tremendous work across the state and across the country, doing the best that they possibly can to get the best outcomes for patients who are suffering from this virus.
Great. All right, Dr. Watson, before we start, any comments you want to share with the folks who have tuned in?
Yeah, I think what's really important is that Health Alliance Plan, as a health plan, is really committed to our membership and to working with our physician and hospital partners to do whatever we can to really support people across the Michigan community. All of our employees are working extraordinarily hard to think creatively, very proactively to reach out to members and think about how our benefits and other programs can really make the most for people in this very challenging time. I know all of our employees are incredibly dedicated and are going out of their way every day to try to make a difference in the lives of our members.
Okay, yes, it's been a very busy few weeks here with us, and we definitely, our whole purpose today is to answer any questions that you have. So once again, if you do have a question for us, please submit it in the comments area below. We'll get to it as soon as we can. And if for some reason we don't get to it, we'll make sure to reach out to you after today's recording. All right, I think we're ready for our first question here, Dr. Watson. And the first question is, what should I do if I think I have coronavirus?
Right. Well, thankfully, there's been a pretty good amount of education about the symptoms and things to look out for if you are suspecting if you have coronavirus. Some of the more common symptoms that people might be on the lookout for are fever or cough or shortness of breath. There are a host of other sort of unusual symptoms as well, but those are probably the more common ones. If you suspect that you may have coronavirus, the first step is really to try to contact your physician. I know a lot of practices are closed these days in order to protect or reduce transmission, but physician practices have been remarkably open, setting up telephone lines, telehealth, and other things to evaluate. Also, many of our health systems locally, Henry Ford Health System and other systems in our network, also have advice lines. So if you don't have a physician, there are advice lines you can call to try to get direction as to what you should do next as far as testing or treatment.
Okay. Yeah, I must say, I have been amazed at all of the tools and resources that have been able to be pulled together so quickly in this time of need for folks to use, given we're in a different situation than we normally are. So we have a question here from a member who has reached out to us. Thank you, Ellen, for joining us. Ellen says, I don't feel comfortable going into the doctor. What should I do? Dr. Watson?
Should you do?
It looks like Dr. Watson has dropped off, but we will get him back online here as quickly as possible. Living in the age of technology here, stuff does happen. I would say while we're waiting for Dr. Watson, Ellen, that if you're not comfortable going into your doctor, there are a significant number of different services available to you today. You can go out and you can use telehealth services. And I see Dr. Watson has joined us again. So I'm going to turn it back over to him. Dr. Watson, right before You left us. Ellen was asking, I don't feel comfortable going into the doctor. What should I
Right.
do?
So, Ellen, and thanks for your patience with that. Ellen, as Steve was probably saying before I came back on, there are a number of resources to try to connect with your doctor without going into the office. Physicians have a remarkable amount of flexibility now by phone, even using platforms like FaceTime or Skype or Zoom to actually connect with you, answer your questions, even do some basic evaluation to see how you're feeling and give you some direction about what level of care you might need. It might be staying at home, it might be getting some treatment at home, or your physician may decide that you need a higher level of care, need to go into the hospital. That primary contact is very important.
All right. Well, Dr. Watson, if I don't have a doctor, what do I do if I have concerns?
Right. So there are a number of people who might not have a primary care physician, or they have a primary care physician, they haven't seen him or her for some time. First thing I would say is you can actually leverage the health plan. If you're a HAP member, you can use our website to get additional information, or our customer service folks can connect you with our advice lines that we work with in the system. If you're connected with a health system, for instance, if you're with Henry Ford and you don't have an assigned primary care physician, you can contact your health system directly, and they usually have physicians or nurses on standby to answer your questions. The last resource is your public health department or the state health department. And the Michigan Health Department and the county health departments also have advice lines and online tools to help assist you, to help you determine what your next best step should be. So your health plan, your health system, or the health department are great resources.
Great. All right, we have a call, or a member, Kathy, who sent us a question. She says, is it okay to take Naproxen, Nsaids, if you have mild symptoms of
Yeah,
COVID-19?
Kathy, this is an excellent question. And one thing I'll say, and I know we'll have some more clinical questions during this hour, the science around COVID virus is changing very quickly. And this is actually one of the clinical questions that's still continuing to be studied. There was some early data to suggest that Nsaids, like naproxen, could be an issue. What I would say for any question like this is to talk to your physician about this, particularly if it's a medicine that you've already been taking. And certainly, if you're thinking of taking a new medicine, you should be talking to your primary care physician, or getting on an advice line and asking that question, because the science around this is changing. Typically, physicians may be asking you to think about alternatives.
All right. And before we move on to the next question, Dr. Watson, I just want to welcome any viewers who may have just tuned in. This is the HAP Medicare Town Hall. If you do have a question that you would like for us to answer for you, please fill it in the comment section below. We'll get to all questions. And if for some reason we don't get to your question before the end of today's broadcast, we will reach out to you. But please submit any questions in the comment section below. So, Dr. Watson, the question here is, what exactly is coronavirus or COVID-19?
So coronavirus is a broad family of viruses. Largely, this family of viruses causes respiratory infections, cough, fever, and other things. The specific coronavirus or COVID-19 or novel coronavirus 2019 is a very specific type of virus that is a little bit different from the common cold and other respiratory viruses that we typically see. It got that designation because it was isolated, first seen in China, and designated by the World Health Organization based on the year of its discovery in 2019. So that virus is a virus that typically will replicate, cause irritation in the lung lining, cough, fever, and other various symptoms that we're still continuing to learn about. There is currently, unfortunately, no vaccine for this virus. There are various treatments, most of which are still under study by many hospitals, including hospitals right here in Michigan. So it is part of a broad family of viruses, but the specifics around this virus do make it very unique in the sense that it is highly contagious and can cause some more severe symptoms that we are now seeing compared to other coronavirus type family viruses.
Okay. Cindy has a question for us. Cindy, thanks for tuning in today. She says, do you have to wash down your groceries with bleach water? I have heard different answers to this question from different resources.
So Cindy, this is a great question. And again, we are still learning about the longevity or how long the virus lasts on certain surfaces. I think that there are concerns about transmission from other surfaces to food. The general sort of advice that has been given by the Centers for Disease Control about this is, number one, if you're outside and you've been out in the stores or other things where you may come in contact with folks with the virus, or where it may be on a surface, it's good to keep things sort of separated from where your food preparation area is. So when you're bringing in your groceries, you should try to bring the groceries themselves out of the bags. Try not to have the bags all over your kitchen. Try to keep some clean surfaces. When you're preparing food and you've emptied your bags, you should make sure you've cleaned that surface again, that you've washed your hands several times after handling the bags. And I would actually recommend disposing of the bags from the grocery store in your outside trash can so that everything is sort of staying outside. There's no need to necessarily wash down all the containers or the boxes that your food came in. We are seeing that the virus doesn't typically last very long on cardboard or other things, but when you just brought those things home, you should just make sure that you're washing your hands. Remember, most of this food you're cooking, so it should not be an issue once you've actually cleaned in between.
Dr. Watson, yesterday you and I were talking, and one of the things that I thought was really interesting, you mentioned daily routine things that we do in your shoes. And if you wouldn't mind, if you could share with folks what you should do with your shoes, because it's something that I didn't even think about until we talked yesterday.
Yeah, actually, I've had a couple of people ask me that question, and because we're often wearing shoes out in public, maybe if you're going to the store, if you're doing other things, want to try to keep those shoes outside the house or outside of a high traffic area. For me, when I come in, I actually try to put my shoes on the step outside of the door inside my garage. If you have sort of a mudroom or just a foyer area, to just keep them by the door if you can't keep them outside the house or in a garage. And certainly if you've been handling your shoes, getting them on and off, you need to wash your hands as soon as you come in the house. So part of this is just keeping a clean barrier between coming in the house and what's inside the house. And that can actually cut down on transmission quite a bit.
Great, thank you. So we have a question here from Denise, and Denise, thank you for joining us today. Denise asks, where can you go to get a test that gives you results within 20 to 25 minutes instead of waiting days for an answer?
Yeah, Denise, we continue to have improvements in testing technology, and there is variability in what tests are available in what locations and how long it takes for a test to turn around. A lot of our testing has gotten better, and the turnaround time on those test results have gotten a bit faster. What I would recommend, if you're looking at areas where you can test, and actually I just looked at it again this morning, the Michigan Department of Health and Human Services, the MDHHS website, actually has a test site locator. We have a similar locator and information on our HAP.org website as well. And that will give you updated information as to where you can get that test. It may not always tell you the turnaround time on that test, but you can ask. So before you go and get tested, you can ask what the typical turnaround time is. I know that health systems have been working very hard to get these tests turned around in the state health department as quickly as possible.
Now, Dr. Watson, we had heard on the news in the early stages when this was just starting to occur that if you needed a test, you should definitely go through your provider or through telehealth before you just showed up for a test. Is that still the case?
What I would say is that for the folks that are wanting to get a test, they should really be thinking about their symptoms and prioritizing where they get that test. We want to try to have people work still with their physician or with their health system to go to the most appropriate level of testing. There are often symptom checkers and other things that can be used online to determine what your level of need is for a test, and then getting directed to the right place for testing. Obviously, people with severe symptoms who might need more rapid testing or more rapid treatment, they may get tested at a different place than somebody who's just curious about whether they've been tested or not. So again, I would still urge you to work with your primary care provider, physician to do that, or work through the various websites to determine your symptoms and the best place to be tested.
Okay. All right. If you do have a question for us today, we're here to answer them for you. So please fill out the comment section below with your question, and we'll get to it as soon as possible. So, Dr. Watson, how is COVID-19 spread?
So COVID-19, like some of the other coronaviruses, are spread basically by droplets, usually by sneezing, coughing. Most of the studies would indicate that droplets and things can go out up to 6 feet. And that's the basis for some of our social distancing instruction currently in place locally and nationally. And so usually it's droplets that are spread from a sneeze or a cough, and then they hit a skin surface and usually go into the mouth, the nose, or the eyes, and that's how that they can then enter the bloodstream. So social distancing is important, public masking like we're recommending now to reduce transmission, and of course frequent hand washing, because even despite all that, you could still get something on your hands, and you want those hands washed, and try to reduce touching your hands or mouth where you could actually create some self-transmission.
Yeah, I noticed just this week when I had to go to the grocery store and I hadn't been in a while, they were turning folks away who didn't have a mask. And so I think people are embracing the importance of these different things that we can do to keep the spread from occurring. Why is coronavirus spreading so quickly?
So coronavirus is a unique virus, as I mentioned earlier, unlike some other viruses where it has a higher rate of transmission. The research would indicate that a single infected individual could, in a short period of time, infect up to 2 or 3 other individuals, and so on. So the rate of doubling or tripling of transmission is quicker, even than other things like the common flu. The other issue that I think is unique about coronavirus is people can actually have the virus and asymptomatically spread. In other words, they may be carrying the virus, they may feel perfectly fine, they're going about their regular duties, and they are unknowingly spreading it to their neighbors or people around them. The last thing is that we're seeing that the onset of symptoms from infection can be quite long. You know, folks who get the flu after exposure can have symptoms sometimes within 24 hours or a day or two. So usually people feel unwell and they self-quarantine themselves because they just don't feel well enough to go out. This is not the case with coronavirus. We're seeing some folks who are having symptoms 2 weeks after exposure, which means, again, they don't know it, that they have this virus. And by the time they do realize it, they may have exposed a lot of other folks. So those things coupled together, the rate of transmission, the lag in symptoms and transmission, and just the ability for it to spread have sort of coupled together to create a very rapidly transmissible virus, unfortunately.
Okay. We have a question from Antoinette. And Antoinette, thank you for joining us today. She wants to know, how long does the virus live on produce, such as the outside of an apple?
Yeah, Antoinette, this is a great question. And again, still ongoing research about how long the virus lasts on different surfaces. This food question has been coming up a lot recently. We're not absolutely sure how long it lasts, although there have not been documented evidence of food
It looks like Dr. Watson may have locked up here with us for just a second on technology. We'll give him a second to see if he rejoins real quick. days of technology here, we run into some of these glitches here and there, but he'll be back shortly. Antoinette, yeah, I do know, as Dr. Watson was saying, their produce, the best advice they can give you is make sure you're washing it before using it, and preferably washing it when you bring it into the home. Dr. Watson, you're back. I was saying the age of technology here, we're trying to get through it, but there's still some glitches. Oh, he jumped off again. Well, that's all right. He'll be back shortly. While we're waiting, if you're just joining us and you have a question, please fill it out in the comment section below, and we will make sure that we get to your questions. If we don't get to them today, we'll make sure that we reach out to you after today's broadcast. All right, so what are some ways HAP is supporting its members during this crisis? And so one of the ways in which we're doing is HAP has waived all testing, coverage, copays, coinsurance for our members. And Dr. Watson is back. And so, Dr.
Okay,
Watson,
Steve,
I'm going to turn
I think it's this,
the age of technology.
I think this snow is wreaking havoc with my internet. I'm not sure what's going on here. So
well, we'll get it to stop.
I appreciate everyone's patience, though. Thank you.
Dr. Watson, the question is, what are some other ways HAP is supporting its members during this crisis?
So HAP is doing a number of things to support members. One of the things that we did very early on, obviously, is remove any barriers to testing. We did not want our members to have cost as a barrier to their testing. So that was one of the early changes we made. Second, we made a lot of changes as far as expanding benefits and doing more outreaches to our members to see if they needed help in this time of crisis. So we have really accelerated our forward outreach to members to make sure that they have what they need, that they're coping okay with social isolation as best as they can. We've also worked very hard every day to put out the best and up-to-date information on our website and to equip our employees with information so that if you are calling in, our employees have the most up-to-date information they can give you. Finally, we've had a tremendous amount of collaboration with our physician partners and hospital systems to accelerate things like telehealth, to remove cost barriers to telehealth. We've actually been heavily involved with Henry Ford Health System and their incident command and making sure that we're doing all we can as a health plan to support them in their efforts, and reaching out to other health systems and physician practices who are adopting new technologies to support their patients. So on all fronts, we're doing all that we can to really support members.
Great. We have a question from Christian. Thank you for joining us. It says, I'm confused by the news. Am I supposed to wear a face mask?
Yeah, Christian, the Centers for Disease Control recently did make a recommendation that folks who are out in the community, even if you are not having symptoms, should try to wear a face mask. This is not necessarily specifically for your protection. It may be actually to protect your neighbors, because as we're learning, there is a high rate of asymptomatic or people without symptoms who may still be carrying and spreading the virus. So again, the purpose of that mask is for you to prevent yourself from transmitting to someone else, and for your neighbors not to transmit to you. The CDC.gov website has a lot of good instruction on how to make home face masks from regular everyday materials. Actually, cloth masks are perfectly fine, and the CDC has some step-by-step instructions on how to do that. And you can wash those masks when you get home and reuse them, unlike using a surgical mask, which is really just a one-time use. So yes, I would encourage you, as long as the CDC is recommending that, to wear a face mask in public.
I really like the limited time I've been out, but even when I'm on my walks and I see other neighbors, how creative people are getting with the different fabrics or materials they're using to make the mask.
That's true.
All right, we have a question from Jamie, and Jamie, thank you for joining our broadcast today. Jamie says, I'm concerned about coming in contact with people that are asymptomatic. Do you have any recommendations?
Yeah, I think this gets back to Christian's prior question about masking. I think the most important thing is following the CDC recommendations on masking in public while that recommendation is still into effect, and social distancing. Again, like Steve, when I'm out shopping and other things, I'm noticing what people are doing in the community. My local store, when I go to shop, I recognize folks from the community, and I'm noticing they're standing 6-8 feet apart in their parking lot conversations, or even when they're talking in the store. So it's just being mindful of the social distancing, the masking, washing your hands. Probably washing your hands is the most important thing you can do to protect yourself and others when you're out in public or at home.
All right. So Christina has a question for us. And Christina, thanks for joining us. She says, is it okay for me to donate blood? Is it safe?
Yeah, absolutely. And Christina, thank you for asking this question. We are in a blood shortage right now, although we are treating COVID, and that is a major focus of physicians and health systems. People have other ongoing medical issues, and blood is absolutely necessary. So it is safe for you to donate blood. All blood is screened on a regular basis by blood banks for various issues. You should always report any symptoms that you've had prior to donating blood. So there is a screening process that folks go through. But I would absolutely encourage anyone who is able to donate blood, call the Red Cross, find local places that are donating blood. We had a blood drive actually at HAP not too long ago to help support our community, and many of our own employees actually came in and donated blood. So please consider doing that if you can.
Speaking of ongoing medical issues, Dr. Watson, before we go to the next question, I just want to bring up, I have a neighbor who reached out to me and said, he has an ongoing medical condition with his liver, and he was concerned that he didn't want to reach out. He wasn't feeling well to his provider because he didn't want to inconvenience the provider. And he was also afraid that if he did need to go in to see the provider about what was occurring, he didn't want to jeopardize his health by going into a setting that might be too risky for him. So my question for you is, what would you tell folks who do have ongoing conditions or may feel that they have something other than COVID that they've come down with in terms of reaching out and working with their provider? Because I think a lot of people are hesitant right now or want to respect that their providers are busy serving those that have COVID.
Now, Steve, this is an incredibly important question. We have many folks in the community who have pre-existing illnesses that they've been managing for some time. And the fact that we have COVID now doesn't mean that those illnesses stop, or that we shouldn't continue to focus on managing your ongoing illnesses, maybe diabetes or high blood pressure or liver diseases in the case of your neighbor. So we definitely want patients to still be dialoguing and talking to their physician about their ongoing medical issues, even if they're not related to COVID. And I can certainly understand people's hesitancy of not wanting to go into the hospital or not exposing themselves to COVID. And the good thing is that physicians are really being vigilant about this. Some of them are actually proactively calling their patients to make sure that their chronic conditions are being managed properly, that they're taking their medicines, that they're not having new symptoms. If you are having symptoms for a non-COVID related condition, you should still be calling your doctor. Your doctor is very concerned that these things continue to be managed. And don't try to self-diagnose. Try to leverage your doctor to make sure that you're taking good care of yourself during this time. They may not want you to come to the hospital. They may not want you to come into the office, but they may still be able to do things to help you even at home.
All right. Well, thanks. I thought it was important that we talked about that too. And Julia, appreciate you being patient with us. Julia, thank you for your question. Julia says, Dr. Watson, when will an antibody test be available to indicate that you may have been a carrier and now have immunity to COVID-19?
Yeah, Julia, again, very important question. So there is a lot of testing and investigation going on right now around the antibody test. I know there's been a lot on the news, particularly in the last week, about antibody testing. Again, I would refer you to typical sites, the CDC and the state health department, about antibody testing. Some of these things are still in experimentation in the sense that we don't fully understand immunity yet, how long immunity is going to last, and what that antibody test actually means. I know this is a very high priority nationally and locally to better develop these tests and get them to the right folks as quickly as possible. So I would stay tuned on those sort of trusted sources. And certainly, as we get more information at HAP that is connected with CDC in the state, we would pass that along as well.
Okay. What does high risk for COVID-19 mean? How do I know if I'm high risk?
So again, we're learning a lot about risk groups for COVID. A lot of what we know now is based on experience from China and Italy, where there were a large number of cases, and now more recently in New York and in the Detroit area, because we have had a large number of cases. Systems like Henry Ford Health System have been doing a lot of research along with other local health systems to understand who are the risk groups. What we know now generally is that the broader risk groups are people who are generally above the age of 50, certainly above the age of 70, are in a general high risk group. Folks who have chronic conditions that might suppress their immune system, folks who are undergoing chemotherapy or may have cancer are at increased risk. And then people who have certain conditions that may make them prone to infection, specifically lung infection, may be at higher risk. So folks with diabetes, heart failure, and folks with underlying lung disease like COPD or asthma. So those are some of the broad groups that we are seeing. However, we are seeing hospitalizations and issues with people in a variety of age groups, but certainly older patients and patients with certain chronic conditions tend to be in that higher risk group. And again, that's something that a doctor, if you reached out to them, would be asking you about your medical history if they did not already know it, if you were having symptoms.
Okay. We have a question from Helen. Helen, thanks for joining us. Helen says, my 11-year-old is scared to hug me or sit close to me because of reports that children are carriers. She is cognizant that I'm okay. The rest of the question's cut off. What would you suggest to Helen?
I'm a dad with 3 boys, and I think, like all parents, we have conversations with our children about this. I would say one thing, it is important that we have conversations with our children about what is going on. There's a lot on the news, and our children need us to be sort of a source of strength and information for them. And children, of course, are remarkable in that they're very concerned about us as their parents, particularly if we may have risk factors. So a couple of things. All of the social distancing, washing hands, those things still come into play with kids and parents together. I think one of the things you want to do is reassure children in general about what reasonable contact you can have. If there are specific clinical conditions that you have that may put you at risk for transmission, whether that be from your own child or another child or someone in the community, again, something to talk to your doctor about, and use that information to reassure your children depending on your specific clinical situation.
Okay. And if you're just joining in, we are answering your Medicare questions in regards to COVID. And this is HAP's Medicare Town Hall. Please feel free to provide any questions you have in the comment section below, and we'll get to them as soon as we can. Dr. Watson, I think we touched upon this earlier, but we can share it again with the folks on the broadcast. Is there a cost to use telehealth?
Yeah, so currently right now, Health Alliance Plan is doing all that it can to really reduce or eliminate out-of-pocket costs for telehealth services. We want people to access their physician by any means possible. And so we have backed out that cost. And we are continuing to look at, as a health plan, how we can sustain and really spread the use of telehealth, because I think we're going to see that patients are really going to appreciate being able to access their physician, particularly when they don't need to go into the office, even when we have kind of come to the other side of this current situation. So no, currently no cost, and we are continuing to look at how we can reduce cost burden to promote telehealth services.
I know a lot of our members have reached out to, and they said, asked us questions about, is it difficult to use telehealth? A lot technology is new, and as we've learned today, even doing this broadcast, we're getting accustomed to it. But is telehealth and teledoc
Yeah, actually,
easy to use?
despite our glitches this morning, it generally actually can be fairly easy to use. And we have been working very closely with the state and federal agencies, as other health plans have, to promote the use of as many platforms as possible. So even using a smartphone with FaceTime and other things is a great platform to be able to access your physician. Remember, physicians are getting used to this technology too and trying to greatly expand it so that they can reach you. Physicians are very concerned about their patients, so they want you to use this technology because they want to help you any way that they can. So going on our website at hap.org, you can get information about how to use telehealth services. You can call our customer service. They can walk you through. There are a lot of resources to help you with that.
All right. And here's a great question. I'm concerned about running out of my prescriptions. Can I get extra to have on hand?
Yeah, absolutely. And this is, again, this gets back to some of the earlier questions about managing your ongoing chronic conditions, even in the midst of this COVID issue. We want you to be able to refill your prescriptions. HAP made a decision to make sure that people could early refill their chronic ongoing medicines, maybe for high blood pressure, diabetes, or inhalers for their breathing, to make sure that they didn't run out. We don't want people waiting till a day or two before their medicines run out to refill them. So you can refill them earlier. And also, we've really promoted the use of mail order so that those can be delivered to your home. So please do not wait till last minute to refill your prescriptions. You can refill them early, and your pharmacy will work with you.
Okay. All right. What if I don't want to go to the pharmacy right now to get my refills? I think you talked about that. How do I get medication?
Again, like telehealth, we're trying to get your care to you when you need it. So many of the pharmacies are doing delivery. We're partnering with Pharmacy Advantage to do mail order for a lot of our HAP members. Most of the local pharmacies are delivering. I know a lot of the health systems through their pharmacies, like Henry Ford Health System, are also delivering to people's homes. We certainly want to make sure that you get your medicines, and all of those that are doing that are doing their best to get those medicines to you at your convenience.
I know I was really just amazed yesterday. I called in at 8 o'clock to Henry Ford West Bloomfield to have a script refilled, and they asked me if I'd like it delivered. I said sure, and by 11 o'clock at my front door was my prescription.
That's
So
great.
yeah, it's really convenient too. So I think post COVID, we're going to see a lot of folks taking advantage of some of these services that have been out there, but they just didn't realize it until we were forced to use it. Um, what is the over-the-counter benefit for Medicare members, Dr. Watson?
Right. So for HAP, for our Medicare Advantage members, many of our members have an over-the-counter benefit. More and more medicines, as folks probably already know, are not necessarily need to be coming from the pharmacy. They're on the shelf. And this is a way for us to defray the cost of your over-the-counter medicines. So typically, folks get a benefit for every 3 months, and they get a catalog that they can order. They can do that online. They can do it by phone and order those over-the-counter medicines. And this is a great way to get those everyday medicines and still get the benefit of no or reduced out-of-pocket cost for those.
Great. I'm seeing a lot of member comments alongside of folks who are commenting on what we're covering. Just want to give a shout out here to Rhonda. Rhonda said that her doctor uses Google Duo, and she has an iPhone and she has an Android, and it's nice. So we have some members out here who are saying they've used the telehealth and they really enjoy it. I do know on the over-the-counter benefit too, one of the things we want to share with our Medicare Advantage members is given the volume that is coming in currently to convey for certain items, you may have an item that you'd like to purchase or order on your over-the-counter benefit that may not be available, but they're working as quickly as they can to fulfill those orders. And I know folks who went out and ordered, and within a week, they had what they needed, even though it was on back order. So just be patient. It's just a very high demand time now that folks are more isolated and need that information. Dr. Watson, what's your advice on how to stay active while we're social
Yeah, this is a
distancing?
great question. So we want people to be physically active during this time. It's extraordinarily important. Even for folks without chronic health conditions, good daily physical activity is a good part of preventive medicine. Certainly for folks who have chronic conditions, daily exercise and daily activity can also help your health outcomes there. I do recognize being socially isolated, you might feel like you can't exercise as much. You can still, I know it's springtime, and as I'm looking outside and I still see the snow coming down, we encourage people going out, taking walks, doing those things. You can still walk in your neighborhood, still maintaining social distancing if you're walking on the sidewalk. When I walk in my neighborhood, I might see my neighbor and we just sort of keep our distance or cross the street or do other things. And folks are having their mask when they're walking, but you can still do that physical activity. Still have my kids go out and play in the backyard and do their exercising and other things every day. Definitely very important to maintain physical activity during this time and at all times.
Yep. And I really would encourage you, if you're a HAP Medicare Advantage member, to tap into your Silver and Fit benefit and take advantage of some of their in-home tools and services that they have for you so while you're isolated and want to stay active. Before we jump to the next question, because we're talking about interacting during social distancing, we have a member, Tamra, who I've seen some comments on the side, who said, "Why won't my kids let me see my grandkids? I feel fine." And you want to talk about that real quick?
Yeah, so this is probably one of the more challenging things. I have my kids have their grandparents as well, and this is a very tough time for our older members of our community. They desperately want to see their grandkids, and it's really to protect them. Children can be carriers, and children largely have done very well during this COVID episode, but they unfortunately could be carriers and transmit to their grandparents or older loved ones in the family. It does not mean that they can't connect. So I still have my kids call their grandparents by phone and talk to them. You can still have them meet at a distance. We've done that a few times where they're in the driveway and the kids are up on the porch. They're very far apart and they wave, or I bring them over and they just wave from the street so they can still see them. But trying other ways to connect is very important. Using FaceTime, using Skype and Zoom, using other ways for younger children to connect with their older relatives. It's very important, and it's important for those older relatives to feel connected as they're socially isolated.
Yeah, I would have to say, especially it's not only older relatives. If you have a neighbor who may not have a lot of family and
Absolutely.
older and
Yeah.
isolated, just walking up and waving into the window and letting them know that you're there and care, it really makes a huge difference and means a lot. And so we just need to, in this important time, look out for each other and do that. I know I have a member on my team who also is a new grandma, and she wasn't able to see her grandbaby, but she went and got to see him through the window. And I know it's driving her crazy that she hasn't been able to actually um, physically get to meet him yet. But it's uh, it's all part of us staying safe right now and making sure we keep the spread from growing. All right, we have Payal. Payal has a question for us, and thank you for joining us today. Payal says, "Are hospitalization costs waived? How is HAP handling more serious patients?"
Right. So there have been some very rapid changes in how we're handling some of the cost and treatment. We have made some changes in cost and treatment benefits specifically related to COVID testing and treatment for HAP. Um, Other types of benefits have remained largely the same. We continue to evaluate that situation and make sure that we're supporting members as best as we can. If you have specific questions about a specific hospitalization or a specific cost, you can always call our customer service and they can clarify that specific issue with you. As far as handling more serious patients, I mean, HAP's role is to make sure that you're getting the care that you need and not having that be a barrier to the care that you may need from your doctor or your hospital. So we continue to partner very closely with our physicians and hospitals to make sure that we're supporting them as they support patients.
Okay. All right. Lisa has a question for us. Lisa, thanks for joining us. Lisa says, is it safe to order takeout? A couple of people would like to know.
Yeah, Lisa, again, great question. Yes, it is safe to get takeout. Obviously, as you can imagine, most of the restaurants are taking extra precaution with takeout, with all of their internal procedures like they normally would, hand washing and packaging and that sort of thing. I am still getting takeout when I can. And it's important that we support our local businesses because this is a very tough time for them. So, a couple of things that I would recommend. This is similar to the grocery question we had earlier. If you get a takeout container, try to keep plastic and things in an outside container like the plastic bags and such. When you bring in a container, try to empty the takeout container into a clean plate or bowl and then dispose of the container that it came in, washing your hands in between each step. Remember, this food is cooked typically, so we're not looking at food transmission. It's usually just making sure that you're washing your hands in between handling external containers. But keep in mind, restaurants are doing a lot of steps also to make sure that they're being safe as well.
We have a member, Dr. Watson, named Eric out online who's asked something similar. We're getting all kinds of deliveries now that we can't go out the way we used to and purchase different items. And Eric wants to know, what precautions do I need to take with deliveries? When you get a package delivered to your home, should you be concerned? Do you need to be concerned about what's inside the package and where it came from?
Yeah, so another good question. So you're ordering things that are being shipped to you. Again, as far as what we know now, typically viruses are not living very long on cardboard, which is typically how things are being shipped. Once things are actually packaged inside a box, they have typically been sitting out for quite a while and haven't been handled directly. And again, like restaurants, a lot of shipping companies are taking lots of precautions as far as how they ship and package things. What I would say is if you get a package on your step, and I've had things delivered to my home where the delivery person comes up, they're keeping their social distance. They put the box on the step, they ring the doorbell, they step back, they wave. When I bring that box inside, I might leave it outside for just a little bit. If I bring it inside, I set it off to the side. I might wait a bit to open it up. Obviously, washing my hands every time I open or handle that box. Usually, once you open up the box, whatever's inside has probably been in there for a bit. So it's probably unlikely that that's a major issue. But again, washing your hands a bit when you're handling packaging.
Okay, great. And before we go to the next question, we still have some time to take some additional questions. So if you do have a question, please submit it in the comment section below and we'll try and get to it. And if for any reason we don't, we'll make sure even after this broadcast that we reach out to anyone who asked a question that we weren't able to answer. So Dr. Watson, we talked a little bit earlier, there are a lot of people at home. They may not have anyone else in the house with them. They may not have relatives who are looking in and checking on them. So how can I deal if I'm one of those folks with feelings of isolation during this time? And really, it could apply to any of us. We're in the house. We can't do our normal routine. So how do we deal with those feelings?
Yeah, isolation it's a very challenging thing, whether you're working, whether you're retired or at home. It's very important to try to maintain some level of routine. So the things that you like to do every day, try to continue to do that and maintain your standard routine. We talked about physical activity earlier. Physical activity is a great way to sort of keep you feeling fit, good about yourself. Feeling connected to other folks. So you may still have people that you're connecting with. Make sure you're phone calling or doing things to stay connected. I know religious and faith ceremonies are very important and that gets disrupted. Trying to get online and connect with your faith community. In addition to that, you can do some new things. You're at home a lot, you're isolated, maybe you start a new project. You do something to sort of develop a sense of accomplishment. Something that you can take some pleasure in. This is an opportunity to try to do some new things in addition to maintaining your standard routine and connections, but in a different way. These things are all very important to cope during this period and also to support one another during that period.
All right. And Dr. Watson, we have Lori who's joined us, and Lori has a question. She says, my snowbird 83-year-old mother is in Florida by herself. Wonder if it's better for her to come back now before everyone starts traveling again.
Yeah, Lori, this is a great question, and something, of course, in Michigan, we deal with a lot with folks who may be out of state. And we have a number of HAP members, of course, that go to Florida every year where we support them there. My recommendation, not knowing all the specifics, is to have a conversation with your mom about that, maybe even with her physician about would it be safe to travel and what are the relative risks and benefits of staying versus traveling. That's a good question to be asking her physician about to make sure that you're making the right decisions there.
Okay. Sarah has joined us, and Sarah says, I have no symptoms. Can I go to a friend's house who also has no symptoms?
Yeah, so as we talked about earlier, the absence of symptoms does not guarantee that you are not carrying the virus at this time. And so part of social distancing efforts is really focused around that fact that folks who may not have symptoms may still be carrying the virus, may still transmit them to one another. I know the temptation is to visit with a friend that you haven't seen for a bit. They're feeling well, you're feeling well, but that still creates the opportunity for transmission during this time. I would encourage you to think about other ways to connect with your friends, maybe having a Zoom night out or a chat or something like that. Certainly, if you feel like you need to see them, seeing them at a distance, that sort of thing.
And I know it's tough because for many of us, we've been, you know, practicing social distance. We've been staying in. We're beyond the 14 days, and so there's that temptation of, well, we should all be good, but until we get through this, we just got to continue to take precautions. All right, Dr. Watson, we have time for a few more questions. If people want to help during this pandemic, what can they do?
Yeah, this is great. And this is something I hear a lot about. I think this is a time where we have really seen the best of people really pitching in and doing things to help. I think at a basic level, the most important thing you can do is adhere to social distancing, washing hands, wearing your mask when you're out in public. That can be the most community-minded thing that you can do because you are slowing down the rate of transmission at a basic level. Beyond that, it's certainly great to engage with community. Steve mentioned earlier, reaching out to people who may feel isolated, calling that neighbor, calling people in your community who may feel alone. If you're able to and somebody needs food, you can deliver food to somebody, shop for them. There are many community agencies that are seeking volunteers, doing some things through social distancing to help people who might need help. There are many different ways that you can contribute and help in this pandemic. Obviously, for folks who are frontline healthcare workers and things like that, they're pitching in. And also thinking about those people who are on the front line, not just healthcare workers, but people in the stores, in restaurants, and other things who are also at high risk and trying to keep the community going during this process. Just having gratitude and thanking those people goes a long way.
Yeah. I'd like to say two things you can do from your home that really can help us make a big difference and show gratitude to those first responders and those healthcare heroes. There's the White Ribbon campaign. And if you can see here, I have my white ribbon that I'm wearing. We encourage you to show your support, post a white ribbon out in front of your home or in your window. There, you can go online to hap.org and get more information on the White Ribbon campaign. But this is to show our support to all of the healthcare heroes and the first responders. The other area is the Well Wishes campaign through Henry Ford. There's a Well Wish campaign that allows anyone to send a greeting to healthcare workers and patients. And you can help and support that by going to Well Wishes at hfhs.org. And all those well wishes get displayed throughout the hospital on the monitors to the patients and all of the providers. And it's one way that you can make a huge contribution without even leaving your home. Additionally, there are a lot of community organizations in need right now. And so any giving you might be able to do to legitimate emergency funds would be most appreciated. And if and when the opportunity presents itself to give blood, as we mentioned earlier, there's a huge need for that. All right, Dr. Watson, I think this is going to be our last question here. But if you do have questions for us, I do want to encourage you to write them down in the comment section below, and we'll make sure after this broadcast that we get back to each and every one of you. Eric asked, Dr. Watson, I've read that if you eat food with the virus on it, that your stomach acids kill it. Is that accurate?
Yeah, Eric, a good question. We're still learning a lot about the virus. There have not really been documented food transmission. Again, I think good food preparation, hand washing, that's the most important thing.
All right. So, Dr. Watson, that was going to be our last question. We're wrapping things up here. Dr. Watson, I just want to thank you for spending time today with us. I know you're very busy. We appreciate your insights and the best ways for our members to stay safe during these very challenging times. I'd also like to thank all of you who are watching. Thank you for joining us today. We want you to know that HAP is here for you. If you have questions, you can ask them here. We'll get back to you, or you can always feel free to reach us at our customer service line and/or hap.org. We'll post a recording of this town hall on hap.org, also on Facebook, Twitter, and LinkedIn channels. And what I would like to ask all of you who are joining us today to do is please like and share this video to help your friends and family members stay informed. You can subscribe to our HAP Facebook page and visit our website at www.hap.org/COVID-19 for all the latest updates. I just want to thank you for taking time today and joining us. These are definitely unprecedented times, and we're all going to get through it. HAP is here for you to help you with whatever you need. And just please stay safe, and feel free to reach out to us with any questions or concerns you have. Thanks again, Dr. Watson. This has been great, and
Thanks so much, Steve.
we really appreciate your time.
Thank you. Take care, everyone. Be safe.